Welcome to your 2013 City of Knoxville Benefits Enrollment. During this presentation, we'll review your coverage options for the upcoming year. Along the way, you'll meet some interesting people, your coworkers, who made the decision to live a healthier lifestyle and are being rewarded for doing so. They received lots of support through the city's My Health plan, and so can you. This is Chief Roush. It's hard to believe he turned 50 this year. He attributes his good health to My Health. It's a great program to help you stay focused. Let's start by reviewing changes to your benefits for the upcoming year. First, let's start with the medical changes. Medical plan per paycheck premiums will increase. The city has kept employee premiums stable for several years, and this year, the claims justified this increase. Additionally, the coinsurance for the 500S and 500P options will decrease from 90% to 80%. This means that once you meet your deductible, you will now be responsible for 20% of the cost of covered services until you reach the out-of-pocket maximum. One other change the city made to all medical plans was mandated by healthcare reform. Vasectomies and tubal ligations will be covered at 100% with no copay or deductible required. Next are the changes to the My Health requirements. Ranges for salary-based HRA incentives have changed to account for salary increases. If you participate in My Health and make less than $30,800, the city will contribute $150 in your HRA at the first of the year. If you participate in My Health and you make between $30,800 and $42,170, the city will contribute $75 in your HRA at the first of the year. We will also have changes to our prescription drug plan with Humana. Generic and over-the-counter contraceptives will be covered at 100% with no copay required. For over-the-counter contraceptives, you must present a prescription at the pharmacy counter to receive 100% coverage with no copay. Weight loss and over-the-counter tobacco cessation products and drugs will only be covered under the My Health plan, and you will be responsible for paying 50% of the cost of the drug. They will no longer be covered under the medical-only plan. See the City of Knoxville drug list for what's covered under My Health. Prescription drug benefits will have new copay amounts and tiers. We will discuss this in detail later on in this presentation. Finally, let's talk about our ancillary coverage. If you enroll for city dental coverage, your premiums are going up slightly for all dental plan options. The city marketed vision coverage for 2013, and IMED was once again awarded the contract as our vendor. They gave the most competitive rates, even though it is an increase to the current rates. Another change that is mandated by healthcare reform affects the amount you can contribute to the healthcare FSA in 2013. The new limit is $2,500. The dependent care limit will remain at $5,000. The city's life insurance contract will remain with Minnesota Life. 2013 will start a new contract with them, and they are offering all employees the opportunity to enroll in supplemental life coverage for themselves, even those that have waived supplemental life coverage in the past. We will talk more about this later in the presentation. Let's talk about medical coverage. When you enroll for city medical coverage, you have three choices to make. You must choose your network, your deductible, and whether you want to participate in the My Health or the medical-only option. Let's take a closer look. You have two network choices, S and P. Network S includes 88% of Knoxville area physicians. It includes Knoxville area hospitals, except hospitals that are part of Tenova, and does not include Summit Medical Group. Network P includes 98% of Knoxville area physicians and all Knoxville area hospitals. You are responsible for making sure the providers you see are in network. The only exception is if you see a doctor in the emergency room. For any follow-up visits, make sure they are in network before you make an appointment. It's important to remember, as you choose your network, that Network P costs more than Network S. In other words, more money is coming out of your paycheck each pay period when you choose Network P. That's because Network P has more participating providers, and those providers have not agreed to discount their services as much as providers in Network S. But Network S also has many participating providers and hospitals. Many city employees are enrolled in Network P but are not using it, either because their doctor also participates in Network S or because they haven't seen any providers in 2012. If you are enrolled in Network P, now is a great time to check if your doctor participates in Network S. If not, would you be willing to change doctors? Look at this. If you switch from Network P to Network S during annual enrollment, you could save hundreds, even thousands of dollars in employee contributions. Of course, your actual savings depends on the deductible you choose and whether or not you join MyHealth. Now, let's look at your deductible options. You can choose the $500 deductible option, in which case you'll pay more in employee contributions. Or you can choose the higher $1,000 deductible option and pay less out of your paycheck each pay period. Let's compare. You can see the $500 plan has a $500 per person or $1,000 per family deductible. The $1,000 plan has a $1,000 per person or $2,000 per family deductible. Now both options have the same coinsurance. This is new for 2013. Once you meet your deductible, the plan will pay 80% and you will pay 20% until you meet your maximum out-of-pocket. Both options cover preventive care at 100% with no deductibles or copays required. And both options have exactly the same out-of-pocket maximum. So the most you'll pay out of your own pocket in 2013 is $2,000 per person or $4,000 per family, regardless of the option you choose, provided you stay in network. So, if you're currently enrolled in one of the $500 deductible plans, should you switch to one of the $1,000 deductible plans? This is a really important question to ask yourself, and here are two more. Do you meet your deductible each year? If not, why are you paying higher employee contributions for a lower deductible? And second, do you have money in your HRA? Some city employees have accumulated a lot of money in their HRAs. This is money that can be used to pay for expenses, including those toward a higher deductible, and you avoid the higher paycheck deductions. Here's how much you can save in paycheck deductions each year if you switch to the higher deductible option. Again, your actual savings depend on the network you choose and whether or not you participate in MyHealth. Which leads us to the last and probably most important choice in selecting your medical coverage, MyHealth or medical only. The MyHealth plan is medical and prescription drug coverage with built-in rewards for committing to a health-conscious lifestyle. The medical-only plan is medical and prescription drug coverage without the built-in wellness rewards. Employees who choose to participate in MyHealth and maintain all of the requirements pay less per paycheck, sometimes significantly less, than employees in the medical-only option. So let's look at MyHealth. MyHealth has been in place since January 2011, and what we know is that it's working. The data proves it. This chart shows that those with health coaching have lower hospital claims over time than those without it. This plan is having a very real impact on the lives of participants. They're losing weight. They are feeling better. and many are learning how to manage chronic conditions that might otherwise threaten their lives. Here's what MyHealth enrollees receive: lower medical premiums, HRA dollars from the city up to $918 a year, free or reduced prescription copays for certain medications, and for people who live with certain chronic conditions, free testing supplies. Let's look at each one more closely. When you choose MyHealth, you pay $277 to $981 a year less than employees who enroll in the medical-only option. Your actual savings depend on the network and deductible you choose. As a MyHealth participant, you also earn HRA dollars, $32 a month for employee-only coverage, or $64 a month if you cover dependents. If you earn less than $42,170 a year, you will receive additional HRA dollars from the city. And if you or a covered dependent participates in the center's prenatal program, you can earn $200 in your HRA. You can use your HRA dollars to pay for qualified medical, prescription, dental, and vision expenses incurred by you and your eligible dependents. This includes out-of-pocket expenses that count toward your annual deductible, copays, co-insurance, and other eligible expenses. Not all expenses are eligible, though. You can visit wageworks.com for a complete list of eligible expenses. This web address is listed in your 2013 Guide to Your Benefits. If you don't spend all your HRA dollars during the year, they roll over to the next and are available to you as long as you remain covered by a city-sponsored medical plan. This includes COBRA and retiree coverage. If you expect to have out-of-pocket expenses greater than the HRA dollars you'll receive from the city, you can contribute your own pre-tax money to the healthcare FSA. Since any leftover FSA dollars are forfeited at year-end, expenses are paid from your FSA account first. When your FSA funds are gone, expenses will then be paid from your HRA. This year, MyHealth participants will not only receive discounted prescription drug copays for medications used to treat chronic conditions, but they will also pay lower copays on non-preventive medications as well. For example, if a medical-only enrollee purchased a 30-day supply of a preventive preferred generic drug, he would pay $5. MyHealth participants would pay nothing. This chart is also listed in your 2013 Enrollment Guide. Finally, MyHealth participants who live with certain chronic conditions can receive free testing supplies. Peak flow meters for those with asthma and/or COPD, a blood pressure monitor for those with hypertension, and diabetics receive a free glucose monitor, lancets, and test strips. MyHealth rewards can really add up to significant savings, but there are some requirements you have to meet. To qualify for MyHealth rewards, you must receive an annual health screening, be physically active and complete a monthly physical activity affidavit, complete quarterly health education, manage any chronic conditions you have, including tobacco use, and seek an annual well care visit for your covered children. The prenatal program is optional. Let's take a closer look at each one. MyHealth participants, including covered spouses, must also receive an annual health screening at the center. You must have received your screening within the previous 12 months for your MyHealth election to be effective on January 1st, 2013. MyHealth participants must be physically active at least 60 minutes a week, which includes at least 3 sessions a week for 10 minutes each. In other words, 1 continuous hour a week would not satisfy the requirements. You must submit a physical activity affidavit every month by the 10th of the month. You can do this either through Blue Cross Blue Shield of Tennessee's Blue Access website, or you can download and print a paper affidavit off the risk management page of the city's intranet and submit it to the center. I'll talk more about the center a little later. Again, to access the physical activity affidavit through Blue Access, you scroll down to the It's a Life Thing logo and click the link. You must also participate in quarterly health education. This requirement can be fulfilled by attending scheduled quarterly education classes or by reviewing CDs, DVDs, and printed literature available at the center, the safety building, or risk management's office in the city-county building. My Health participants with certain chronic conditions must work with a center health coach to actively manage their condition. This includes people with asthma, chronic obesity, congestive heart failure, COPD, coronary artery disease, diabetes, high cholesterol, or high blood pressure. Enzo is a perfect example of how using your health coach as a resource can have a positive impact on your life. Tobacco users must participate in a health coach program offered through the center. And if you're enrolling in My Health for the first time, you must complete the tobacco certification section of the 2013 annual enrollment form. Tobacco cessation drugs are covered under the city's medical plan if you are enrolled in the My Health program. Finally, you must provide documentation that each of your covered children under age 26 had an annual well care visit through their own physician within the previous 12 months. The prenatal program offered through the center is optional. If you or a covered dependent becomes pregnant in 2013, you may enroll in the city's prenatal program by the 10th week of pregnancy and receive an HRA contribution upon delivery of the baby. If you choose not to participate in My Health but still want city-sponsored medical and prescription drug coverage, you can enroll in the medical-only option. Medical and prescription drug benefits are available for medical-only participants, but premiums for medical-only coverage are higher than My Health, and there are no built-in rewards such as HRA dollars and lower prescription drug copays. So let's walk through a couple of examples of choosing your medical coverage. If you're going to pay attention to any part of this presentation, now is the time. It could mean big savings in your wallet. Say you want employee-only coverage. You choose Network P, a $500 deductible, and medical only because you're not terribly motivated to work on your health. You would pay $55.42 per paycheck for coverage, or a little over $1,300 a year. Now, say you just make one little change from Network P to Network S. Everything else stays the same. Your paycheck deduction would drop to $26.79. Your annual cost for coverage would drop to roughly $650, saving you close to $700. Pretty nice, huh? Now, say you make two changes. You not only switch networks, you also switch to the higher deductible. You're still holding firm on the medical-only part, and that's okay. Your paycheck deduction would drop even further to $12.10 per paycheck. Your annual cost for coverage would drop to less than $300, and you would save over $1,000. Now we're talking. You can see you just increased your annual deductible by $500, but you saved nearly $1,000 in paycheck deductions. So here's the grand finale. Say you do the whole shebang and decide to try this healthy living thing by joining My Health. You're now paying a whopping 54 cents per paycheck. That's $12.96 a year, and you're saving over $1,300. That's $1,300 that is not coming out of your paycheck, and that doesn't even factor in all the rewards you get for participating in My Health. Let's do this one more time with family coverage. If your coverage is employee plus spouse or employee plus children, you can count on saving somewhere between the single example we just did and this example. So again, say you choose Network P, the $500 deductible, and medical only. You would pay $267.25 per paycheck for coverage, or $6,414 a year. If you simply switch from Network P to Network S, your paycheck deduction would drop to $183.79, or $4,410.96 a year, and you would save over $2,000 just for switching networks. Now, let's add a higher deductible to the new network. Your per paycheck deduction would drop even further to $139.26. Your annual cost would drop a little over $3,300, and you would save nearly $3,100. Again, you increased your annual deductible by only $500, but you're saving nearly $3,100 in paycheck deductions. Finally, let's say you really want to save and get healthy in the process. You make the network and deductible change and sign the family up for My Health. You're now paying less than $110 per paycheck, or just under $2,600 a year. You're now saving $3,800 a year. That's $3,800 not coming out of your paycheck. And, of course, that doesn't factor in all the rewards you get for participating in My Health. Wow. The bottom line is, figuring out the best coverage for you and your family takes some thought and a little math. But if math's not your best subject, there's help available. One common theme among My Health enrollees is that you have to do it for yourself. After all, there's only one you. But say you don't plan to enroll for city medical coverage. You can still earn some rewards even if you waive medical coverage. If you can provide proof that you have medical coverage elsewhere, the city will make a $500 contribution to a healthcare FSA in your name. You can then use those dollars to pay for eligible healthcare expenses incurred by you and your dependents during the year. And if you complete the annual health screening through the center and fulfill the physical activity requirements we talked about earlier, you can earn a $20 per month physical activity incentive. You can also use acute care services at the center for a $5 copay. Pretty nice. Now, let's turn our attention to the center. Most of you are already familiar with the city's Health, Education, and Wellness Center, also known as the Center. If you're enrolled in My Health, you've probably come to know the center well. You don't have to be enrolled in My Health to use center services. All city employees can use the center, but My Health enrollees receive services for a lower copay. Every quarter, the center offers free health education classes on subjects like nutrition, exercise, diabetes management, and more. Although these classes are open to anyone, My Health participants can attend them to meet their quarterly education requirement. The center also provides free health coaching for employees with specific health concerns. The staff there work closely with you to help you achieve your goals and empower you to take better care of yourself. The center also provides treatment for short-term illnesses for a small copay. You and your covered dependents ages 13 and older can take advantage of these services and pay with cash, check, a debit or credit card, or your WageWorks card. The center is run by Summit Medical Group, and all staff are bound by the same confidentiality requirements as any other healthcare provider. HIPAA privacy rules require that your health information be treated confidentially, and the center abides by those rules. That means that the city never sees your personal information. Your 2013 Guide to Your Benefits provides more information about the center, including the address and phone number. Although I've spent most of our time talking about your medical options, there's much more to your city benefits, including dental, vision, flexible spending accounts, life insurance, and voluntary products. You can read more about each of these benefit plans online at cityofknoxville.org/benefits. Your 2013 Guide to Your Benefits provides descriptions of each plan. But let me give you a few reminders. First, dental. If you're eligible for city benefits, the city provides a free base dental plan that includes an annual exam, a cleaning, and a set of bite wing x-rays for you. Your spouse and children are not eligible for this base plan. However, you can take advantage of this free plan and purchase additional coverage for yourself and your eligible family members. You'll find more information about your dental options in your 2013 Guide to Your Benefits. If you choose to enroll in the dental plan, there will be a slight employee contribution increase in 2013. The city also provides all benefits-eligible employees with an annual eye exam for a $10 copay if you use an iMed provider, as well as discounts on products. You don't have to be enrolled in the vision plan to receive this benefit. You can purchase additional vision coverage for yourself and your eligible family members, which covers exams, lenses, frames, and contacts. If you choose to enroll in the vision plan, there will be an employee contribution increase in 2013. One major change to the healthcare FSA is a change due to healthcare reform. The maximum you can contribute to your healthcare FSA in 2013 is $2,500. If you want to participate in one or both of the city's flexible spending accounts, you must re-enroll each year. Your 2012 FSA participation does not automatically carry over. And participants, remember that you must have a prescription from your doctor if you want to pay for over-the-counter medications with your FSA or HRA dollars. Health-related supplies, such as insulin, do not require a prescription. If you have a prescription for an over-the-counter medication, you can use your WageWorks card as long as you present your prescription at the pharmacy counter. For a list of eligible over-the-counter medications and supplies, see the 2013 Guide to Your Benefits at cityofknoxville.org/benefits. Your life insurance options are the same as last year, but with a 20% reduction in premiums on supplemental life. As a reminder, the city provides basic life coverage equal to $50,000 at no cost to you. You can purchase supplemental coverage for yourself, your spouse, and or your dependent children. Each year at annual enrollment, you can increase your supplemental life coverage by $10,000 or $20,000 with no medical questions asked. If you make any other changes to your or your spouse's coverage, you must provide proof of good health for approval by the insurance carrier before your coverage increase can go into effect. Additionally, for the 2013 annual enrollment only, if you have previously waived supplemental life in the past, you can elect $10,000 in coverage for yourself only with no medical questions asked. Then next year at annual enrollment, you may increase your coverage by $10,000 or $20,000 up to the guarantee issue limit. More information, including forms you may need, are on cityofknoxville.org/benefits. The city also offers several voluntary plans which you can only elect during annual enrollment. They include lifetime benefit term insurance, cancer insurance, critical illness insurance, and accident insurance. If you were hired after October 2011, you will receive a personalized enrollment form. You simply check the coverage you want and you're done. No medical questions will be asked. If you previously declined this coverage but wish to add it during annual enrollment, call the 800 number listed in your 2013 Guide to Your Benefits on cityofknoxville.org/benefits. In this case, evidence of insurability will be required. Now that we've reviewed upcoming changes to your benefits and given you a more in-depth look at your medical options, it's time to enroll. You have until November 5th to choose your 2013 benefits. Enrolling is easy. Just go to cityofknoxville.org/benefits to get started. If you don't go online to enroll before November 5th, your 2012 benefits will continue in 2013, except for FSA and Benefits Bucks participation. You must enroll to continue these plans. Once your benefits for 2013 become effective on January 1st, you generally can't change them during the year unless you experience a life event such as getting married or having a baby. Life events that allow you to change your benefits mid-year are listed in your 2013 Guide to Your Benefits. Here are a couple of last reminders. If you are enrolling your spouse for medical coverage for the first time, you must complete a spouse surcharge affidavit. This attests to the fact that your spouse doesn't have coverage available elsewhere. If your spouse does have coverage available elsewhere through his or her employer, you may be required to pay a $50 per paycheck surcharge. Also, if you are enrolling dependents for 2013 coverage, they must meet the city's definition of dependent to be eligible. You can find the definition of eligible dependents here in your 2013 Guide to Your Benefits. However, this year the guide is available online at cityofknoxville.org/benefits. And if you have any questions along the way, Risk Management is here to help. Thank you for your time.